The files are not stories. They are not fiction. They are records, fragments pulled from the dark, sealed once, unsealed now. For those who dare to listen, each carries its own weight, its own silence, its own risk. What you are about to hear is one such record. Listen carefully, because once a file is opened, it cannot be unheard. The night shift nobody survived begins with phantom heartbeats echoing through Operating Theater 7 as Dr. Kira Blackfang's Border Collie ears twitch beneath her surgical cap. Monitors display vital signs for patients that don't exist while her black and white fur bristles against sterile gown fabric. Antiseptic vapors burn through her sensitive canine nostrils as power fluctuations cast strobing shadows across empty stainless steel tables where phantom blood pools and bone-dry drainage channels. Surgical instruments arrange themselves with metallic precision on trays she never prepared. Scalpels positioning at perfect angles while suction devices activate automatically, clearing invisible surgical sites of blood she can smell but cannot see. Temperature plunges 3 degrees as condensation beads on observation. Windows overlooking deserted corridors where only phantom footsteps echo through the isolation wing. Anesthesia machines hiss steady cycles to maintain unconsciousness for creatures that exist only in monitoring readouts. Dr. Blackfang's surgical claws tremble as she approaches the empty table where vital signs indicate critical emergency blood pressure falling toward 70/40. Respiratory distress climbing past 32 breaths per minute. Her canine instincts screaming danger while medical training demands she save lives that aren't there. Multiple emergency alarms cascade across every theater as phantom patients crash simultaneously, requiring expert veterinary intervention that will push her enhanced senses to the brink. And she realizes with growing dread that this night shift is an endless marathon of surgeries on invisible suffering that feels more real than reality itself. Case File 005, classified under Surgical Anomalies Protocol Alpha. Subject Dr. Kira Blackfang, age 29, species Canine Border Collie, role emergency veterinary surgeon at Northridge Animal Research Hospital, isolation wing, security clearance level 3. Specialization in higher-risk trauma and experimental procedures. No prior anomaly exposure flagged. Exemplary surgical record until incident onset. Dr. Blackfang's species typical traits include 2.3 million olfactory receptors, enabling precise scent discrimination. Auditory range from 20 Hz to 60 kHz, enhancing detection of imperceptible frequencies. And superior low-light vision for nocturnal operations. These capabilities, initially considered advantageous in emergency surgery, are now reclassified as vulnerability factors in anomaly engagement. The anomaly manifests as phantom surgical emergencies in operating theaters, detected through equipment activation without human interface, self-arranging instruments, and vital sign monitors displaying data for non-existent patients. Environmental systems respond with full surgical protocols, lighting at 100% lumen output, ventilation at sterile air exchange rates, antiseptic dispensers activating automatically, despite zero scheduled procedures or personnel presence. Security footage confirms Dr. Blackfang entering empty theaters and performing complex surgical procedures on invisible subjects with clinical precision. Monitors record stable vital signs, heart rate 60 to 80 beats per minute. Blood pressure 90/60 to 120/80 millimeters of mercury. Respiratory rate 16 to 24 revolutions per minute for phantom patients spanning multiple species profiles. Tactile feedback from surgical instruments indicates realistic tissue resistance. Olfactory sensors detect phantom blood scent mixing with antiseptic fumes. Auditory receptors register phantom heart monitor, beeps, and anesthesia machine hisses synchronized to her surgical cadence. Forensic timestamps correlate anomaly intensity with power grid fluctuations. At 3:17 a.m. on December 3rd, Monitors display peak phantom activity. Atmospheric conditions maintained at 18 degrees Celsius. Humidity 40%. Barometric pressure 1013 HPA. Electrical interference at 50 Hz. Harmonics aligns with phantom surgical peaks. Dr. Blackfang's neural stress markers elevate beyond normal thresholds after 90 minutes. Continuous phantom engagement, indicating potential for irreversible sensory integration. Psychological assessment reveals Dr. Blackfang experiences complete sensory immersion, exhibiting empathy responses, elevated oxytocin levels toward invisible patients. Her medical oath compels intervention, despite absence of physical subjects. Repeated phantom surgeries risk neural adaptation, potentially rendering her unable to distinguish between phantom and real medical emergencies. Containment protocol: isolation wings sealed, all operating theaters locked, anesthesia and surgical equipment to be deactivated remotely. Power grid stabilization unit engaged. Subject to be monitored for neural adaptation symptoms and potential self-harm due to sensory overload. Threat level 5. Maintained due to high risk of permanent sensory integration and physical self-injury during phantom procedures. Operating Theater 7 glows under surgical lights, emitting frequencies that penetrate Dr. Kira Blackfang's Border Collie auditory range at 45,000 Hz. Each fluorescent tube creating harmonic resonance patterns that vibrate through her skull while she scrubs antiseptic solution between claws that tremble with anticipation her veterinary instincts cannot explain. Betadine burning orange streaks across black fur as phantom vital signs materialize on monitors displaying heart rate 72 beats per minute for a Calico feline patient whose absence defies every medical protocol she learned in veterinary school, yet whose suffering registers through enhanced canine senses as absolutely real. The metallic scent of phantom blood saturates sterile air, mixing with surgical antiseptic, creating olfactory combinations that trigger salivation responses. In her canine physiology, while temperature sensors record 18 degrees Celsius though, cold spots manifest around the surgical table, where phantom body heat should radiate, but instead creates condensation patterns on observation windows that form geometric shapes. Resembling feline silhouettes, her enhanced vision detects despite knowing no patient lies on the stainless steel surface that reflects surgical lighting in patterns. Her Border Collie depth perception interprets as anatomical landmarks. Surgical instruments arrange themselves with mechanical precision that defies gravitational physics. Scalpels positioning at perfect angles while retractors size themselves for medium feline abdominal surgery through processes. Her logical mind rejects, yet her medical training accepts as necessary preparation for emergency intervention on phantom anatomy that exists only in enhanced sensory perception, but demands identical surgical expertise to save invisible lives whose survival creates satisfaction patterns in her brain chemistry identical to successful real surgeries. She dons surgical gloves, feeling phantom weight distribution beneath sterile drapes, approximately 12 pounds, consistent with adult calico anatomy, while anesthesia machines hiss isoflurane delivery at precisely calculated rates for feline lung capacity. Her veterinary knowledge confirms as medically appropriate. Despite ventilating invisible respiratory systems that create fabric movement patterns, her enhanced vision tracks with predatory focus. Inherited from generations of Border Collie, breeding selected for visual acuity and movement detection. Her first incision encounters resistance patterns, transmitted through scalpel handle into nerve endings that register tissue. Density identical to living epidermis, while suction devices activate automatically clearing phantom blood. Her olfactory system processes as genuine hemoglobin despite visual confirmation of empty surgical field. Each anatomical layer responding with tactile feedback that bypasses rational thought and triggers muscle memory developed through years of veterinary training on countless real patients whose survival depended on identical surgical techniques now applied to invisible anatomy. Phantom organs radiate warmth through surgical gloves, creating temperature gradients. Her enhanced canine thermoreception detects as completely authentic, while phantom respiratory movement creates subtle air currents. Her whiskers register as evidence of living presence, despite surveillance cameras recording empty space, and her logical mind screaming warnings about psychological breakdown that her medical oath overrides with compulsive need to save lives regardless of their physical existence. Timestamp 3:29 marks power fluctuation that dims surgical lighting for 3.7 seconds, during which her enhanced night vision maintains perfect awareness of phantom surgical field, while emergency generators engage with mechanical hum that resonates through her sensitive hearing, creating auditory landscape of institutional medical emergency that validates her phantom surgical response as appropriate professional behavior, despite rational knowledge that she operates on empty space filled only with enhanced sensory hallucinations. The Calico feline's phantom liver laceration bleeds at rates correlating with monitor displays, while her claws perform vessel ligation on invisible arteries. Using microsurgical techniques that require steady hands and precise depth perception, her border collie genetics provide through generations of breeding for fine motor control and visual spatial intelligence, now applied to phantom anatomy that responds to expert surgical intervention with healing patterns identical to living tissue repair. Her enhanced hearing detects footsteps echoing through corridor spaces that security protocols confirm contain no personnel, while phantom heartbeat strengthens under expert medical care, creating auditory feedback loops that reinforce the reality of invisible patients requiring continued surgical attention despite growing cognitive dissonance between enhanced sensory input and rational analysis of impossible medical situation. Phantom peritoneal fluid pools beneath her gloves, creating tactile sensations that trigger professional responses developed through veterinary residency training, while her olfactory system processes complex scent combinations of blood, antiseptic, and tissue repair that validates surgical progress despite visual evidence contradicting every phantom sensation. Her enhanced canine senses interpret as medical reality requiring expert intervention. Power surges intensify at time stamp 3:34, causing overhead lights to flicker in patterns that correlate with phantom vital sign fluctuations, while Dr. Blackfang adjusts ventilator settings for respiratory distress. Her medical training recognizes as critical emergency, requiring immediate response regardless of patient visibility. Her professional competence compelling continued surgical excellence on anatomy that exists only in enhanced border collie perception, but demands identical expertise to save real lives. Phantom tissue responds to microsurgical repair with healing patterns. Her tactile senses confirm through suture tension and wound edge approximation, while monitoring systems display recovery vital signs that validate surgical success, despite operating theater remaining visually empty throughout complex abdominal procedure that pushes her enhanced canine capabilities toward complete integration with phantom medical reality. The phantom diaphragm reveals laceration damage her fingertips detect through surgical gloves, while phantom serosanguinous fluid creates taste sensations on her canine tongue that confirm tissue injury requiring expert repair through layered sutures placed with millimeter precision. Her veterinary training demands for successful healing outcomes on patients whose existence transcends visual confirmation and depends entirely on enhanced sensory perception validated by monitoring equipment that registers phantom presence through vital sign displays. Environmental sensors detect phantom metabolic heat production, while air circulation systems respond to invisible respiratory requirements, creating atmospheric changes. Her enhanced senses interpret as evidence of living patient recovery despite surveillance documentation of empty surgical theaters throughout. Isolation wing where phantom medical emergencies continue requiring expert veterinary intervention that blurs boundaries between enhanced perception and psychological integration with impossible medical reality. Surgical closure completes with textbook precision as phantom tissue accepts sutures that feel identical to living repair work while vital. Signs stabilize under expert medical care, creating professional satisfaction identical to successful real surgeries that saved actual lives. Her medical competence validated through phantom patient recovery, despite cognitive awareness that enhanced. Border Collie senses create complete surgical hallucinations indistinguishable from veterinary reality. The Phantom Calico feline achieves complete surgical stability through expert intervention, while monitoring systems confirm recovery patterns before phantom presence fades from enhanced perception, leaving Theater 7 in sterile silence with surgical instruments showing no evidence of complex procedure just completed. Dr. Blackfang, alone with traumatic knowledge that phantom surgeries create identical professional satisfaction to real life-saving procedures while threatening her ability to distinguish between enhanced canine perception and actual medical emergencies, requiring genuine veterinary intervention. Emergency alarms cascade throughout isolation wing, summoning her to additional phantom surgical crises as she realizes each invisible patient saved reinforces integration with phantom medical reality that may eventually prevent recognition of real animals requiring actual surgical care in genuine medical emergencies that demand professional response, rather than enhanced sensory hallucinations that feel more authentic than veterinary reality itself. Operating Theater 2 floods with emergency lighting as Dr. Kira Blackfang's Border Collie ears detect phantom distress calls at frequencies beyond human hearing range, while monitors display critical vital signs for a German Shepherd patient whose invisible presence triggers every emergency protocol. Her veterinary training demands heart rate spiking to 180 beats per minute, blood pressure undetectable, respiratory failure imminent, all readings compelling immediate intubation on phantom airways that exist only in her enhanced canine perception, yet feel absolutely real beneath laryngoscope blade, guided by muscle memory. Developed through years of emergency veterinary practice on countless real patients whose survival depended on identical techniques now applied to invisible anatomy that responds with perfect tactile feedback through surgical instruments that arrange themselves with mechanical precision defying physics, while her enhanced senses create complete surgical reality, indistinguishable from actual medical emergency. Specialized endotracheal tube slides through phantom vocal cords, encountering resistance patterns identical to living canine anatomy, while her claws detect proper placement through pressure. Feedback transmitted via laryngoscope handle into nerve endings that register tissue density and warmth gradients. Her enhanced thermoreception interprets as evidence of living patient, requiring expert medical intervention, despite surveillance cameras recording empty surgical table throughout complex intubation procedure that triggers professional satisfaction identical to successful real airway management. Ventilator settings calibrated for large canine physiology deliver precise tidal volumes while phantom chest rises and falls. Creating fabric movement, her enhanced vision tracks with predatory focus inherited from generations of Border Collie breeding selected for movement detection and spatial awareness now applied to monitoring. Invisible respiratory patterns that validate mechanical ventilation success through visual confirmation. Her rational mind knows impossible, yet her medical training accepts as necessary patient care. Emergency thoracotomy requires immediate chest entry through intercostal space, her scalpel selecting while phantom ribs part under expert surgical technique. Each layer of invisible tissue yielding realistic resistance patterns that bypass rational thought and trigger muscle memory as she isolates massive pulmonary hemorrhage bleeding at rates that correlate with monitor displays showing blood loss, threatening patient survival within minutes, unless expert surgical intervention succeeds in controlling invisible bleeding that her olfactory system processes as genuine hemoglobin mixed with antiseptic, creating complex scent combinations that validate surgical urgency. Phantom lung tissue collapses under her fingertips, revealing traumatic laceration extending through multiple lobes, while suction devices remove blood. She smells but cannot see, creating visceral confirmation of internal damage, requiring microsurgical repair techniques that push her enhanced Border Collie capabilities toward complete integration with Phantom surgical reality, where professional competence transcends visual evidence and depends entirely on tactile feedback through instruments that respond to invisible anatomy with perfect resistance patterns. Power fluctuations at timestamp 408 create strobing emergency lighting while she performs vessel ligation on Phantom pulmonary arteries using hemostats that clamp invisible tissue with tactile confirmation transmitted through surgical handles into nerve pathways developed through veterinary residency training, where steady hands and precise depth perception determined patient survival rates. Now applied to Phantom anatomy that exists only in enhanced sensory perception but demands identical surgical excellence to save invisible lives, whose recovery creates neurochemical satisfaction patterns indistinguishable from successful real procedures. Cardiac arrest alarms trigger immediate chest compressions on invisible sternum, her claws applying expert pressure rhythms while Phantom heart muscle responds to CPR techniques learned through emergency veterinary certification, each compression generating tactile feedback as defibrillator paddles charge, delivering electrical shock through Phantom ribs that conduct energy she feels as tingling sensation in her surgical gloves, while heart rhythm returns to stable patterns validated by monitoring equipment displaying recovery vital signs despite visual confirmation of empty surgical field. Epinephrine injection follows intracardiac route, guided by Phantom anatomy, her enhanced spatial awareness, navigating invisible heart chambers while medication effects register through monitor displays showing improved cardiac output and blood pressure stabilization under expert medical intervention that transcends rational analysis and depends on professional competence developed through years of veterinary practice on real patients whose lives she saved using identical techniques, now preserving Phantom existence that challenges every assumption about medical reality. Environmental sensors detect Phantom metabolic heat production, while air circulation systems respond to invisible respiratory requirements. Creating atmospheric changes, her whiskers register as evidence of patient recovery, despite surveillance. Documentation showing empty isolation wing throughout complex thoracic surgery that demonstrates surgical expertise on anatomy visible only through enhanced Border Collie perception validated by instrumental readings that confirm Phantom presence. Through vital sign monitoring, Phantom German Shepherd responds to expert surgical care with healing patterns, her tactile senses confirmed through tissue approximation and suture tension, while ventilator weaning proceeds successfully as spontaneous breathing resumes in invisible patient. Each inhalation she detects through stethoscope pressed against empty space that transmits Phantom breath sounds, her enhanced hearing processes as evidence of respiratory recovery following successful surgical intervention on anatomy that exists beyond visual documentation, yet responds to medical treatment with complete physiological authenticity. Surgical closure completes with textbook precision, as Phantom thoracic cavity accepts sutures placed with millimeter accuracy, while monitoring systems display stable recovery parameters before emergency alarms cascade from multiple operating theaters throughout isolation wing, summoning her to concurrent Phantom surgical crises that multiply beyond any single veterinarian's capacity, yet demand expert response from enhanced canine capabilities that blur boundaries between professional competence and psychological integration with impossible medical scenarios. Temperature gradients shift around empty surgical table as Phantom body heat dissipates, while antiseptic dispensers complete sterilization. Cycles on instruments that show no evidence of complex thoracic surgery despite Dr. Blackfang's tactile memory of saving invisible life through expert medical intervention that created identical professional satisfaction to successful real procedures, while threatening her ability to distinguish between enhanced perception and actual veterinary emergencies, requiring genuine surgical response rather than Phantom medical scenarios that feel more authentic than reality itself. Theater 2 returns to sterile silence as Phantom presence fades from enhanced perception, leaving behind only antiseptic scent and traumatic knowledge that each Phantom surgery reinforces integration with medical hallucinations that may eventually prevent recognition of real patients requiring actual veterinary care and genuine emergencies were enhanced. Border Collie senses must serve living animals rather than invisible phantoms whose existence depends entirely on sensory perception that transcends rational medical practice while creating surgical memories indistinguishable from life-saving procedures performed on actual patients whose survival validated her veterinary expertise through real, rather than phantom medical intervention, requiring professional competence rather than enhanced hallucination that transforms isolation wing into phantom hospital, populated by visible patients, demanding expert surgical care that exists only in enhanced canine perception, yet feels more real than veterinary practice itself. Operating theater for hums, under emergency backup lighting, at 5:45 a.m., December 3rd. Wrote as Dr. Kira Blackfang's Border Collie ears detect a triad of heartbeats emanating from monitors that pulse at ultrasonic frequencies, 90 beats per minute for the snow leopard, 200 for the golden eagle, and 85 for the python, each value synchronized to internal phasing in machines her colleagues cannot see. The antiseptic scent thickening with an ozone undercurrent from backup generators resonating through her sensitive canine skull and igniting adrenal fur along her spine even as her medical oath compels her into the sterile field where phantom instruments assemble on hovering trays, mechanical feline scale retractors, jeweled avian micropins, sinuous reptilian coalomic scalpels, each tool gleaming under surgical lights that intensify automatically to phantom emergencies, her muzzle twitching at a phantom copper temps of blood that melts with antiseptic vapors and traces invisible hemorrhage pathways she maps, with gloved fingertips pressing into calibrated nothingness, yet receiving flawless tactile feedback from anatomy only she can perceive as living. Her Border Collie tactile grid ablaze with sensory input as she inhales cold antiseptic vapor mixed with saline and plasma warmth, each breath drawing phantom pheromones into olfactory receptors that process invisible patient distress with startling clarity, while her enhanced hearing picks up phantom respiratory sounds from 3 distinct species, creating a symphony of suffering only she can perceive, mapping the snow leopard's abdomen by tracing micro-temperature gradients beneath her glove where phantom body heat radiates in patterns matching feline anatomy textbooks, her scalpel poised for the first incision through invisible epidermis executed with a smooth slide that resonates through her claw-tipped digits as if carving into real flesh, each hypothetical layer parting under expert command while phantom muscle fibers separate along anatomical planes. Her veterinary training recognizes instantly, suction priming itself and clearing phantom blood. She smells as fresh hemoglobin mixed with the metallic temps of surgical steel and the sweet corruption of internal bleeding. Her olfactory system validating every drop despite visual emptiness, while her enhanced canine senses create a complete anatomical map through scent alone, then locating a severed mesenteric artery by discerning minute pressure differentials transmitted via nerve endings and clamping it with millimeter precision before knotting invisible sutures whose tension she gauges by the resistance under her claw tips. Techniques honed through years of trauma, surgery on living patients whose survival hinged on identical maneuvers, now saving a creature that exists only in her enhanced perception, yet responds with physiological accuracy that defies rational explanation, her heart racing yet her hands unwavering, as monitors dip to 70 beats per minute, then rebound under her intervention in perfect physiological harmony while phantom purring vibrates through her surgical gloves creating tactile confirmation of feline gratitude, the phantom peritoneum undulating beneath her gloves as she navigates to deeper invisible layers that respond with responsive warmth and resistance matching living tissue, while Phantom organs pulse with life rhythms her enhanced senses detect through micro vibrations in the surgical field, then pivoting seamlessly to the golden eagle's wing where Phantom feathers whisper against her forearm, marking a humeral fracture only her enhanced vision and tactile memory can register, the invisible plumage carrying scent markers. Her canine nose identifies as wild raptor musk, mixed with the copper temps of bone marrow exposed through fracture sites. Microscissors slicing through imperceptible skin layers, producing faint vibrations her gloves transmit directly to her somatosensory cortex, while Phantom flight muscles contract under her touch in patterns that match her understanding of avian anatomy from exotic veterinary training. Her claws aligning translucent phantom bone fragments, with micropins clicking into place under her precise grip, the click resonating in her skull like a confirmation tone, while phantom bone marrow oozes warmth against her fingertips in patterns that validate proper pin placement despite visual absence of any patient, followed by a gentle irrigation of warm saline. So fine, she tastes droplets on her tongue as they settle against her fur while phantom wing membranes flutter in sterile airflow that she both sees and hears through predator-trained senses inherited from generations of border collie, breeding selected for movement detection, and prey tracking now repurposed to monitor phantom patient recovery. Ventilator cycles adapting to avian respiration patterns while monitors stabilize at 180 beats per minute to match phantom avian baseline as invisible chest rises and falls with mechanical precision that her enhanced vision tracks despite knowing no bird occupies the surgical table. Then in quick succession, addressing the python coiled beneath its drape by positioning a reptilian scalpel at midsection, slicing through invisible scales and subcutaneous layers calibrated by her exotic species residencies, while phantom serpentine muscle responds with the distinctive texture patterns she learned during her pitological surgery rotations. Phantom organs shifting under her touch until she locates a ruptured spleen by tracing diffused warmth gradients across her glove, while phantom reptilian scent glands release stress pheromones her canine nose processes as evidence of patient distress, requiring immediate intervention, excising damaged tissue with micro-precision, while phantom blood vessels constrict under her surgical manipulation in patterns matching reptilian physiology, cauterizing phantom vessels via electric cautery device crackling in her claw as heat arcs confirm each seal, while the distinctive smell of cauterized reptilian tissue fills her nostrils with olfactory confirmation of surgical success, then suturing smooth muscle layers closed in a running stitch, pattern mastered through reptile surgery practicums while phantom coils shift beneath her, gloves and responses that match her textbook understanding of serpentine anatomy, despite visual absence of any reptilian patient, monitors showing the python's heart rate dipping then stabilizing under her expert care while phantom hissing sounds resonate through her enhanced hearing as evidence of successful surgical intervention. The labyrinth of sensorthy, reptilian pheromones mingled with antiseptic, and the ozone smell of electrical equipment operating beyond normal parameters confer real-world validation to her enhanced olfactory mapping, while her border collie instincts, sharpened by generations of herding and search and rescue training, fuel an unbreakable drive to protect these invisible lives with unwavering focus, in spite of the glaring mismatch between her enhanced sensory reality and cold surveillance footage displaying empty draped tables and silent equipment racks that contradict every tactile memory of the life-saving procedures she has just completed with surgical excellence that would be remarkable even on visible patients. Timestamp 5:57 a.m. triggers a power surge plunging the theater into darkness for 4.3 seconds, during which her enhanced night vision and acute tactile maps guide every movement as her claws complete layered sutures on the leopard's abdomen, while phantom purring vibrates through her gloves. Secure the eagle's wing pins, while phantom wing beats flutter against her forearms. And finish the python's coalomic closure, while phantom scales ripple under her touch. All procedures continuing in perfect synchronization with phantom physiology, despite complete visual blackout before. Emergency lights restored to reveal 3 monitors, displaying stable readings: snow leopard heart rate 80, eagle respiration 24 per minute, python blood pressure 120/8, each value pulsing in serene affirmation of her phantom miracles, while surveillance cameras record only vacant draped tables. An unsettling contradiction that tugs at her rational mind even as professional pride surges with neurochemical intensity, identical to the satisfaction she experiences when saving. Rhea lives in actual surgical emergencies. Operating Theater 6 ignites under secondary emergency power at 6:22 a.m. December 3rd. Road as Dr. Kira Blackfang's Border Collie ears detect for overlapping heartbeats emanating from monitors pulsing at ultrasonic frequencies. 64 beats per minute. 4. The adult chimpanzee whose phantom breathing creates subtle air currents, her whiskers detect. 48 for the bottlenose dolphin, whose echolocation clicks resonate through her enhanced hearing despite visual absence. 84. The juvenile gorilla whose phantom knuckle-walking vibrations transmit through floor tiles into her sensitive paw pads. And 210 for the African gray parrot whose phantom wing beats flutter at frequencies only her canine auditory range can process, each reading synchronized to phantom physiological rhythms her colleagues cannot perceive, while the antiseptic scent thickens with briny marine undertones, mixed with the earthy musk of primate sweat and the faint temps of avian preen oil, creating an olfactory orchestra that overwhelms her enhanced nose with species-specific pheromone signatures she learned to identify during exotic veterinary rotations, yet never expected to encounter simultaneously in phantom form. Instruments materialize on hovering trays with mechanical precision that defies physics. Neurological microdrills calibrated for simian cranial thickness. Aquatic respiratory adapters designed for cetacean blowhole anatomy. Heavy-duty retractors sized for great ape thoracotomy procedures. And feather needle sets engineered for delicate avian microsutures, each tool gleaming under surgical lights that adjust lumen output automatically to phantom patient requirements. Her enhanced vision detects through micro-movements in sterile drape fabric, her muzzle quivering at the complex melange of invisible patient sense, while her tactile sensors map topographic heat signatures across 4 operative fields that radiate warmth patterns, matching textbook anatomical diagrams despite containing no visible life forms. She steps forward with paws silent on ceramic tile, her claws brushing sterile draped fabric to estimate phantom weights through pressure distribution patterns. 70 pounds for the chimpanzee, whose phantom respiratory movement creates fabric oscillations her predatory vision tracks. 300 pounds for the dolphin positioned in dorsal recumbency, whose phantom mass creates temperature gradients she detects through her gloves. 400 pounds for the gorilla whose phantom chest expansion generates air displacement her sensitive whiskers register. And just under 1 pound for the parrot perched invisibly on its surgical positioning jig, whose phantom tail feathers create micro-air currents her enhanced senses interpret as evidence of avian presence, requiring immediate orthopedic intervention. She inhales deeply through her muzzle, tasting a diagnostic blend of antiseptic vapor mixed with saltwater temps from the dolphin, mammalian perspiration from the primates, and sweet pheromones from the parrot, creating a sensory blueprint that guides her sequence of interventions without hesitation, while her border collie training provides the focus and determination needed for complex, multi-species surgical procedures that push her enhanced capabilities toward complete integration with phantom medical reality. Beginning with the chimpanzee's neurological crisis, she secures a transparent phantom Cranial stabilizer on invisible skull anatomy, guided by tactile feedback through her surgical gloves. Positioning the device by feeling phantom bone landmarks learned during primate anatomy courses. Then drilling precise burr holes into non-existent bone layers with a micro drill that vibrates at haptic frequencies, transmitting bone density contrasts directly into her nerve pathways. Each rotation confirming proper depth penetration as she accesses phantom cranial cavity, parting invisible dura mater to relieve intracranial pressure indicated by monitor spikes, reaching dangerous levels of 25 mm of mercury. Her claws performing subdural hematoma evacuation with suction that removes phantom sarasanguinous fluid she tastes as metallic earthiness mixed with the distinctive copper tints of primate blood, each droplet providing olfactory confirmation of pathology her veterinary expertise recognizes as requiring immediate surgical intervention. Without pausing, she transitions to the bottlenose dolphin by applying a custom aquatic respiratory adapter to phantom blowhole anatomy, her claws guiding precise placement via tactile feedback, transmitted through specialized latex sleeve patterns that conform to cetacean anatomy, then initiating mechanical ventilation calibrated to marine mammal tidal volumes, while the rhythmic hum of the ventilator merges with her accelerated heartbeat as she performs emergency thoracotomy on invisible marine tissues, her scalpel incising through phantom blubber and muscle layers with resistance feedback that identifies tissue densities in perfect alignment with her exotic veterinary training, isolating and repairing a ventricular laceration caused by boat propeller trauma through continuous microsutures, anchored in invisible myocardium that responds to her surgical technique with healing patterns she confirms through tactile sensation, monitors recalibrating to stable 48 beats per minute as cardiac perfusion normalizes under her expert intervention. She moves immediately to the juvenile gorilla whose phantom chest compressions echo respiratory distress patterns. Her enhanced hearing detects as wheezing sounds that don't register on surveillance audio, heavy-duty retractors spreading the phantom ape's thick pectoral mass she feels through coarse fur patterns, mapped against her glove surface. Locating a torn pulmonary vessel that bleeds phantom blood, she smells as warm iron mixed with the distinctive earthy scent of great ape physiology, applying hemostatic clamps that close with satisfying mechanical clicks resonating through her skull as confirmation tones, then suturing intercostal muscles in precise multi-layer closures, paced by her inherited border collie precision and timing, learned through generations of breeding for fine motor control. Monitors displaying respiratory stabilization at 18 breaths per minute as phantom lung function returns to normal parameters under her surgical care. Finally, she attends to the African gray parrot perched invisibly on its sterile positioning jig, her enhanced vision detecting minute wing membrane movements that indicate fracture displacement. Delicately threading feather needle sets through phantom feather calamy with micro-precision guided by tactile feedback that distinguishes between healthy and damaged flight feathers, reattaching an avulsed humeral fracture through orthopedic techniques, requiring millimeter accuracy she learned during specialized avian surgery rotations. Each microsuture placed with resistance feedback confirming proper bone alignment while phantom wing beats flutter against her forearm as evidence of successful repair. Monitors spiking to 210 beats per minute before steadying as flight capability returns under her expert intervention. Timestamp 6:38 a.m. triggers a secondary power surge that plunges the theater into stroboscopic lighting for 7.3 seconds. Emergency systems cycling through backup power, while her enhanced night vision and muscle memory guide every movement as she completes critical closure procedures on all 4 phantom patients simultaneously, her claws knotting absorbable sutures. In complete darkness, through reflexive surgical choreography learned during veterinary emergency training, dura repair for the chimpanzee, cardiac closure for the dolphin, pulmonary suturing for the gorilla, and wing stabilization for the parrot. Each procedure continuing in perfect synchronization with phantom physiology, despite visual blackout, emergency lighting restoring to reveal monitors displaying stable recovery parameters across all 4 species, while surveillance cameras record only vacant operating tables draped in sterile fabric. Automated sterilization misters flood the room with antiseptic vapor that dissipates the complex mixture of phantom scents, her olfactory receptors detecting the gradual fading of briny marine odors. Primate musk and avian pheromones as invisible presences withdraw from her enhanced perception, leaving only the clinical sterility that contradicts her tactile memories of life-saving procedures performed with surgical excellence that would be remarkable even on visible patients. Her professional satisfaction, identical to successful real surgeries, while knowing her phantom achievements exist only in enhanced sensory perception that transcends visual reality. Operating Theater 8 pulses with emergency backup lighting at 7:05 a.m. December 3rd. Wrote as Dr. Kira Blackfang's Border Collie ears. Registers 6 distinct heartbeats from unseen patients, 2 kittens at 140 beats per minute each, whose phantom mewing creates ultrasonic distress calls only her canine hearing detects. An adult Anatolian shepherd at 92, whose phantom panting generates warm air currents her whiskers register as respiratory distress. A Malagasy tree boa at 75, whose phantom tongue flicking sends chemical signals her olfactory system processes as reptilian fear pheromones. A juvenile raccoon at 160, whose phantom chittering resonates through her enhanced auditory range as nocturnal distress vocalizations. And a Great Pyrenees pup at 100, whose phantom whimpering triggers protective instincts embedded in her border collie. Genetics, each value oscillating on monitors in perfect anatomical synchronization, while antiseptic vapors mingle with the complex bouquet of feline stress hormones. Canine perspiration, heavy with adrenaline, reptilian musk mixed with shed skin particles. Nocturnal marsupial scent glands releasing fear compounds, and puppy pheromones signaling pain and confusion that her enhanced olfactory receptors disentangle in a sensory tapestry of living distress she alone perceives through enhanced canine genetics that transform invisible suffering into tactile reality. Instruments materialize on hovering trays with mechanical precision that defies gravitational physics. Microscalpels, calibrated for kitten skull thickness. Pediatric forceps-sized 4-shepherd intercostal access. Specialized reptile retractors designed for serpentine anatomy. Fine-tipped graspers, engineered for raccoon organ manipulation. And orthopedic braces customized for large breed puppy bone density, each tool gleaming beneath surgical lights that modulate lumen output automatically. In response to phantom vital sign fluctuations, her enhanced vision tracks through minute fabric movements in sterile drapes, her muzzle quivering at the layered aromas that create olfactory maps of invisible anatomy, while her tactile sensors detect phantom heat, signatures radiating through draped tables in patterns, matching veterinary textbook diagrams despite containing no visible patients. She measures estimated weights through pressure feedback transmitted via her surgical gloves, 2 pounds each, for the kittens whose phantom respiratory movements create subtle fabric oscillations her predatory vision follows. 90 pounds for the shepherd whose phantom chest expansion generates air displacement her sensitive whiskers detect. 4 pounds for the boa, whose phantom coiling motion creates temperature variations she maps through her enhanced thermoreception. 8 pounds for the raccoon whose phantom grooming behaviors transmit microvibrations through the surgical table into her sensitive paw pads. And 75 pounds for the pup whose phantom tail wagging creates rhythmic air currents her ears track, despite visual absence of any patient before inhaling deeply through her muzzle, tasting antiseptic saline mist, flavored with species-specific pheromone compounds that guide her diagnostic decision-making with forensic accuracy, inherited from generations of border collie breeding selected for scent discrimination and tracking, abilities now applied to phantom medical emergencies. She begins with the 2 kittens, whose synchronized distress demands immediate cranial intervention. Securing miniature phantom stabilizers on invisible skulls through tactile landmark identification learned during feline anatomy courses, making bilateral burr holes with micro drills that vibrate at precise haptic frequencies. Transmitting bone density contrasts directly into her nerve pathways, each rotation confirming proper depth penetration as phantom cranial pressure releases, parting invisible dura mater with microsurgical precision to access subdural space where phantom hematomas require evacuation via suction that clears copper sanguineous fluid she tastes as metallic earthiness mixed with the distinctive iron temps of kitten blood, each providing olfactory confirmation of pathology that threatens phantom lives now preserved through her surgical expertise. Monitors dipping toward critical ranges then rebounding to stable parameters as intracranial pressure normalizes under expert intervention that saves invisible patients whose existence she validates through enhanced sensory input that transcends visual reality and creates complete medical scenarios requiring identical surgical excellence to real emergency procedures. Without pausing, Dr. Kira Blackfang transitions from feline neurosurgery to the adult Anatolian shepherd's thoracic crisis, her paws gliding across the polished floor as she positions pediatric forceps calibrated for canine intercostal spacing, retracting phantom ribs with exact tension that resonates through her gloves and into her refined proprioceptive map, detecting thoracic cavity depth identical to real-world anatomy despite the absence of any visible patient. Monitors display the shepherd's heart rate spiking to 120 beats per minute under stress, the scent of canine adrenaline intensifying as phantom pulmonary edema floods the virtual lungs, her enhanced olfaction capturing ozone-like notes of alveolar fluid mixing with antiseptic vapors, guiding her scalpel through skin and muscle layers with micro-adjustments reflected instantly in haptic feedback that confirms each tissue plane before she ligates ruptured pulmonary vessels with absorbable sutures whose not tension she gauges through micro-resistance changes under her claw tips, the shepherd's phantom oxygen saturation rising in response to her skilled intervention as mechanical ventilator. Cycles adjust automatically. 2 canine tidal volume requirements, she senses, through fabric movements on the drape, while her ears pick up faint phantom coughs, echoing through the sterile chamber as signs of returning respiratory function. Next, she attends the Malagasy tree boa coiled beneath its drape, her claws selecting specialized reptile retractors that slip between invisible scales and subcutaneous layers with gentle force, drawing them apart to reveal phantom coelomic contents conditioned by her reptile surgery residencies. The boa's monitor pulses at 75 beats per minute, while her olfactory system detects pheromonal stress markers unique to boa constrictors. Guiding her to a ruptured intestinal loop she locates by tracing warmth gradients across the soft tissue map she creates through glove feedback, excising necrotic segments with surgical scissors and performing anastomosis, using continuous microsutures that her canine muscle memory places with millimeter accuracy. Monitors reflecting normalized coelomic pressures as peristaltic activity resumes under her deft touch, while the antiseptic saline mist she tastes on her tongue confirms completion of coelomic lavage and tissue viability. Simultaneously, she addresses the juvenile raccoon's abdominal trauma by slipping fine-tipped graspers beneath draped fur to gently lift phantom organ masses, identifying a lacerated spleen by faint fabric bulges. Her tactile senses interpret as life's pressure point, performing a partial splenectomy with preservation of neighboring pancreatic tissue as she sutures surocell surfaces in an intricate pattern that creates leak-proof seals she confirms through subtle tension feedback in her gloves. Monitors showing the raccoon's heart rate stabilizing at 140 beats per minute as hemodynamics normalize, while her nostrils flare at a hint of gamey raccoon musk dissipating under antiseptic airflow. Finally, she completes the Mass-Casualty sequence with the Great Pyrenees pup's orthopedic crisis. Her paws setting a custom orthopedic brace on phantom tibial landmarks. She maps by palpating subtle bone protrusions through fur patterns detected in her gloves, aligning fractured bone ends using pressure-guided manipulation that replicates real-world orthopedic reduction techniques. The pups monitor, displaying erratic heart rate and perfusion as the massive limb. Trauma sends shock waves through her olfactory system, and her border collie instinct compels rapid stabilization. She injects phantom bone growth stimulant microspheres into marrow cavities using ultrafine needles, whose clicks resonate at ultrasonic levels in her hearing. Monitors shifting to a calm 100 beats per minute as perfusion returns to the limb. Microsurgery complete within minutes. Timestamp 7:19 a.m. Ushers in a cascading power spike that flickers the theater lights in stroboscopic bursts for 6.2 seconds. Her enhanced night vision and proprioceptive acuity guiding her blind knotting of layered closures across all 5 patients. Claws moving with choreographed precision learned through uncounted hours of emergency veterinary simulation. Emergency lighting restoring to reveal monitors radiating steady vital signs and surveillance. Cameras capturing only sterile draped tables. Automated sterilization misters flood the room, peeling away every trace of feline pheromones, canine perfusion, reptilian musk, and marsupial scent even as her olfactory receptors detect their fading. Akisa's sensory eulogy to Phantom lives. She has saved Anne stepping out into the corridor. Her claws click a resolute cadence on the tile that mirrors 6 heartbeats now carried within her. Alarms already beckoning her to further crises. Each echo a reaffirmation of her unwavering vow. No patient, seen or unseen, shall suffer on her watch. Her veterinary mastery and border collie intuition forever intertwined in the unending pursuit of healing beyond the limits of conventional perception. Operating Theater 10 fell silent at 8 a.m. on December 3rd. But on Dr. Kira Blackfang's console, 12 phantom patient monitors flashed urgent red. These weren't voices she could see, just a chorus of invisible life signs rising and falling in unison. The Calico cat's racing heartbeat from her 3:17 a.m. abdominal repair. A German shepherd's chest struggling weeks after her 4:08 a.m. thoracotomy. And every other creature she'd saved this night. Her border collie ears strained against a wave of phantom whimpers, kitten cries, equine hoofbeats, far too loud in empty halls, squeaks from rats she treated for sepsis. Even the soft moo of hypothermic calves she'd warmed. Antiseptic mist swirled with the sharp tang of phantom blood leaking from unseen incisions. Holographic timelines flickered around her. 5:45 a.m. multi-species emergencies. 6:22 a.m. primate and dolphin interventions. 7:05 a.m. dual kitten 7:19 a.m. Mass-Casualty triage. Now every case converged into a single crisis. A phantom sow in the recovery ward teetered on catastrophic dystocia. Phantom rodents, racked by sepsis, burrowed through vents. Phantom horses writhed in strangulating colic, and newborn phantom calves trembled on the brink of hypothermia. A low growl of determination rumbled through her chest. Instinct and training merged as she issued rapid-fire commands. Deploy drapes. Calibrate obstetric forceps. Prepare microdialysis filters. Ready laparoscopy modules. Warm neonatal incubators. In response, sterile drapes slid down from overhead rails. Trays of instruments hovered into place. Antiseptic misters hissed precise bursts, and surgical lights flared onto full brightness. She moved first to the sow's station. Without seeing the animal, her gloves traced the phantom uterine contractions until she felt the shape of a piglet's head. She guided forceps through invisible tissue layers that offered real resistance, performed a precise episiotomy, and delivered 2 phantom piglets whose soft squeals vibrated through the terrazzo floor. Monitors showed their heartbeats steady at 90 beats per minute, and the mother's vitals settled back to normal as she irrigated phantom tissue with warm saline, tasting its faint sweetness before closing the sutures, knot by knot. Next came the rodents. She braced herself against a wave of ammonialist scents and located 8 phantom rats in septic crisis. Her gloves detected minute heat signatures in vein pathways. She threaded microcatheters to filter toxins, watched monitors record clearing blood, and administered broad-spectrum phantom antibiotics until fevers subsided and white blood cell counts fell back to safe levels. The equine colic suite thrummed under phantom hoofbeats as she set trocars into unseen flanks. Ultrasound imaging and tactile feedback guided her through invisible twists in the intestines. She reduced torsions, removed necrotic segments, and sealed bowel anastomoses with ultrasonic energy that she sensed as a faint warmth in her gloves. The horse's phantom vitals eased back into a calm rhythm, heart at 40 beats per minute, breathing at 14. Finally, she tended to the hypothermic calves. She draped an incubator around an invisible newborn, threaded a fine catheter through its umbilical stump, and infused a dextro solution. The calf's phantom krylo and urgent echoed through her auditory field as its heart rate climbed from 80 to 120, and its body temperature rose to a healthy 38 degrees Celsius. Throughout these dozen emergency interventions, the facility's power grid groaned under the load. At 8:35 a.m., emergency lighting flickered out for 12 seconds, plunging her into darkness. Unfazed, her enhanced night vision and muscle memory carried her through phantom defibrillations and CPR on invisible chests. Her claws compressed phantom hearts with perfect rhythm until the lights returned and monitors blazed back to life. At 8:42 a.m., the anomaly finally ebbed. All 12 phantom wards registered stable, green readings. The antiseptic haze lifted. Dr. Blackfang stood alone in Theater 10, whiskers trembling with exhaustion and triumph. Around her lay only empty equipment and the echo of every phantom life she had saved. In that hush, she felt the real thump of her own heart, a testament to her unbreakable covenant of care, binding her border collie instincts and surgical skill to every invisible patient she brought back from the brink. Dr. Blackfang steps out of Theater 10 at 9:15 a.m., December 3rd, as the isolation wing hums back to normal. 12 phantom patient monitors now display steady, green readings, evidence of every life she restored. The Calico's quiet purr, the German Shepherd's calm breath, the swineherd's relaxed pulses, the rat's clear blood counts, the horse's even gait, and the calves' warm vitality. Environmental controls report normal temperature and humidity. Cameras record only empty rooms. Forensic logs confirm her tactile, olfactory, and auditory data matched surgical outcomes to real-world emergency procedures, proof that compassion knows no bounds. Her heightened senses subside, replaced by the familiar rhythm of her own heartbeat and the soft click of her paws on polished floors. In the hush, she carries the echo of every invisible heartbeat she saved, a living testament to her unbreakable oath as a border collie surgeon, to heal every patient, seen or unseen. End of Case File 005. This has been Case File 005. Phantom patients were dying, filed, transcribed, and preserved in the record. The cases are many, the files are endless, and though they close here, remember, the anomalies do not stay bound by paper, nor by voice. They linger, they wait. If you choose to return, come prepared. Bring silence, bring patience, and leave your heartbeat unmeasured until the next anomaly finds you. The archivist will keep watch.